Hi, everybody. Welcome to a peer-driven solution to isolation and social exclusion, Part 2. This is the second of 3 training webinars that Mental Health America is putting on regarding our It's My Life social self-directed care program. Make sure that you have the speakers on your computer turned way up, and then you'll be able to hear our wonderful presenters. So this program is being sponsored by Janssen of Johnson & Johnson. So we'd like to thank them for their sponsorship before we even get started. Today, I would like to introduce our 2 speakers. We have Patrick Hendry. He is the Vice President of Peer Advocacy, Support, and Services for Mental Health America. You can see his bio up on the screen. He's been in the field for a very long time, and he worked on a pilot program of our social self-directed care program that we are now distributing across the country, and he can offer you consultant services and help you get this set up in your community if you'd like. Our second presenter is Siobhan Carpenter. She's a life coach and was part of the pilot program. So today, the 2 of them are going to be training you on how to implement this in your communities and how to use that in your communities. Just a little bit about Mental Health America. We are the nation's oldest advocacy organization for mental health. We were founded in 1909 by Clifford Beers, himself a consumer of mental health services, and we advocate for recovery and person-driven care, and all of these great things that you'll be hearing about throughout the webinar. And if you'd like more information about us, you can, of course, find us online at mentalhealthamerica.net. So I'm going to turn this over to Patrick to get started. Patrick?
Thank you, Casey. So this is a program that we started off piloting about 2 years ago, and this is the second webinar in a series of 3 webinars to basically give you an understanding of how the program works. The purpose of It's My Life is to improve people's lives who have been disconnected from the community at large, kind of pushed to the margins of society because of their diagnosis and because of their economic factors of often a diagnosis of mental illness leads to a life of poverty. Participants in this program receive the services of life coaches who are specially trained peer specialists. They start off as certified peer specialists and then receive additional training. And the program's innovative in that it uses the evidence-based practice of psychiatric rehabilitation and peer support and the emerging best practice of self-directed care and individualized, person-centered, and strength-based practices. The results are so individual that everybody finds their own way in this program. That's why it's a self-directed care program. And when people feel isolated and disconnected from the community, that tends to take away your sense of self and who you are and what your place is in the world. Connecting back to the community has the opposite effect. It increases self-esteem and self-worth and really improves your overall functioning both in mental health and in physical health. It's a non-clinical program. When we set up the program, we really tried to take out all clinical language with the exception of, for our pilot program, we decided to work with people with a diagnosis of schizophrenia or schizoaffective disorder, and that was because typically people with these disorders have the most difficult time of anyone in society in building relationships and connecting to community. Some of that is because of the symptoms where people may be withdrawn or unresponsive, but a lot of it is also because the diagnosis they receive and the discrimination and stigma that goes along with it tends to push them out of the community. Given the complexity of these 2 different diagnoses and that social functioning is so evidently impaired, the need for really innovation was evident to us. And so we were searching for quite a long time to find a way to help these people to connect to the community. traditional approaches like medications and hospitalizations and psychotherapy and pretty much anything that you might receive in the traditional behavioral health field has limited effectiveness when it comes to socialization and work aspects of individuals with psychiatric disabilities. Although the program focused in the pilot phase on people with schizophrenia and schizoaffective disorder, the principles of it will really work for anybody who is feeling disconnected from the community. The pilot program focused on the most isolated and marginalized individuals, and social functioning with people with schizophrenia and schizoaffective seems to be impaired and be evident at all stages of the illness. Even recent data shows that these difficulties may be the first signs of the illness, often preceding the other symptoms by many years. So the way basically the program works is that we started off by hiring 2 certified peer specialists who then went through specialized life coach training, both through Boston University, taking psychiatric rehabilitation courses, professional life coach training, and then social inclusion training that we provided as part of the program. The next step was that we had to go out into the community and recruit people. And again, because we were choosing to set this pilot up in the most difficult of situations, we not only worked with people with specific diagnoses, but we tried to work with people who were receiving the most intensive type of outpatient treatment, which was the ACT model, and people who were living on SSI, because poverty is another big reason why people are disaffected from the community. Once we brought people in to the program, we would interview them, and the first thing they would do is they would get a chance to actually interview the coaches to choose which one they wanted and to create a partnership with that coach for the rest of the program. Then they would move into the skill building phase and to the assessment phase, where people try to determine what their real goals are in terms of social skills and connection to community. And so the coaches would work with each person individually. They would accompany them into the community. They would help them to identify things that they were interested in, and then identify activities where they would find other people with similar interests. Coaches, like I said, would actually go into the community with people, and in the beginning really served as friends to each individual, though the goals of the program were that as people gathered skills and became more proficient at building relationships, then the coaches kind of withdrew their services while these new relationships bloomed. Throughout the program, we used a number of evaluation techniques that we talked about in the last webinar, but basically we were looking primarily at quality of life, and we used something called personal outcome measures. We also, though, were interested in seeing if connection to community had any effect on other aspects of people's lives. So one of the questions we asked was about prior hospitalizations that people had had in 2 years prior to the program. And we also had people complete anonymous satisfaction surveys throughout the program so that we could get honest answers as to how they felt the program was going and how they would like to see it grow and evolve. So some of the tools that we use in It's My Life are peer support, which, as we all know, is mutual support. It's bringing together the knowledge of the individual and the skills of the individual in recovery who is acting as the support person, and matching it up with people who have similar shared life experiences. Peer support has was named an evidence-based practice in 2007 by the Center for Medicaid and Medicare Administration. And peers have been remarkably effective in encouraging people to engage in their own recovery, self-activate and manage their own treatment, and helping people to connect and establish supportive relationships. We also used, like, as I said before, professional life coaching skills, and this was so that life coaching is kind of a cheerleader type of activity where you're really trying to motivate people to find the things that interest them most in life and help them to move into positive directions. One of the techniques we used in that was motivational interviewing, which is a person-centered, goal-oriented approach for facilitating change through exploring and resolving ambivalence, or helping people to find out what it is that they really want and how they can form a plan to achieve those goals. And then we use psychiatric rehabilitation, which is also person-centered and strength-based, to help people develop emotional, social, and intellectual skills that they need to live and learn in the community with the least amount of professional support. In peer support, one of the best tools that we have is effective listening. Effective listening focuses on the individual, and the peer supporter is not distracted by their own opinions or judgments or feelings. They try and actually hear what the person is saying to them, and they try to demonstrate to the person that they're listening to them by utilizing some of the active listening techniques of signaling, reflecting back things that people have said, giving affirmations or affirming and validating people's comments, asking relevant questions, clarifying things that people have a hard time understanding, summarizing after people have talked so that you make sure that what you heard is what the person was actually saying, maintaining eye contact and positive facial expressions throughout the discussions, nodding in an affirmation, and kind of open body posture. All of these things communicate to the individual that you are really there to pay attention to what they have to say. So in effective listening, the first thing you want to do is listen to really understand the individual, not just to the words that they're saying, but what are their feelings and emotions, and even what is it that they're saying but not verbally? What does their body language express? What does their tone of voice express? You try to give each person the space to talk freely and make sure that they understand that they're not being judged or compared to anyone else. You want them to explore their lives without fear of judgment or interruption. You also need to be aware of the participants' wants and needs so that you can ask the questions that will help guide them to the solutions they're seeking. A really important tool in any kind of social program, but also in behavioral health as a whole, is shared decision-making, which is really a very simple process. It's where decisions for treatment or services are made on a mutual basis in a partnership between the caregiver and the person receiving services. And there are certain kinds of steps that you can take to build this up. The coaches try to work as partners with the individual so that all of the decisions that are made are kind of done in this partnership type way. So if a person chooses to totally self-direct, they're free to do so as they want. But the other thing is that we want to teach people about shared decision-making because it has greater impact in the rest of their lives. You know, it helps people to establish better relationships with their doctors or their therapists or job coaches or just about anybody that they have to deal with on a professional basis. Shared decision-making is really about respect and dignity. One of the most important things we can do is to not empower the participant. The participant needs to discover and claim and take on their own power. So what the coach does is creates an atmosphere that encourages people to be powerful and helps them to understand the difference between power and force. Power comes from the inside, and it doesn't have to be forceful. All of us have power. It's how we choose to use it that makes the difference. Coaches assist participants in having full access to the resources that might be unused in the community or within themselves and may even be unknown to the person. And so to find their hidden strengths. Coaches focus on empowerment when an obstacle that people encounter or a setback has occurred and the person becomes discouraged. They also focus on it when participants label as a weakness something the coach might see as a strength. And when a participant discounts a resource or skill that has the potential to really enhance their life and the effectiveness of achieving the desired goals. Coaches also focus on empowerment when the participant's inner voice is predominantly negative. And a lot of us, indulge ourselves at times in negative self-talk. And affirmations are a real strong tool to overcome negative self-talk. In the very beginning of the program, the most important thing that the coach does is to help the individual to figure out what are their real goals in terms of what are they seeking in their social life and their connections to the community. Because in order to make major change in your life, you have to really tap into things that are very important to you as an individual. Does the change that you're going to make improve your quality of life? Is it something that you can measure? And can it be positively stated in something that you want to bring into your life, not something you want to take out of your life? Each goal statement is put through something we call impact. And parts of that process are, is the goal that the person have achievable in their present situation and with their current abilities? And if not, what do they need to make it achievable? Does the goals that they set for themselves call forth actions? So does it call forth an action that you can take on a regular basis to begin to create new healthy habits? And then the other thing we look for is that things be time limited, because the only way we make really meaningful changes in our life is when we see progress being made. So if we set our goals too high from the very beginning and it's something we have to work on for years and years, you're never going to have that feeling of accomplishment. So you want to set your goals in stages. In intensive goal setting, the questions that you really are trying to ask yourself is, what will you do to achieve that goal? How much or how many things will you do to achieve it? And how often will you do it? When will you do it? And then you want to step back and you want to look at your goal and the plan that you've made and give it a confidence rating of 0 to 10. And if it's below 7, then you need to figure out what can I do to change my goal and my plan so that my confidence that I'll achieve it is higher than a 7.
And to help our participants accomplish this, we design worksheets and activities that they would do with their coach to be able to set these action planning goals and to make a plan for accomplishing each goal. So these are all parts. Yes.
Go ahead.
Okay. I'm having to do this offline, Patrick. So there is these are all life coaching skills part of the training that we went through as peer support specialists and life coaches. And so there is, in fact, a written exam that we've created to demonstrate understanding of the concepts of life coaching based on the book that we used. And that exam is available for individuals who are going through the training to be peer life coaches. The next part was motivational interviewing. Patrick, you want to get us started there?
Yes. Motivational interviewing, when we teach this to peers, we're not trying to get people to become therapists or counselors, but we're trying to give them a tool to help people to find their own motivation. And so in motivational interviewing, what you want to be able to do is make sure that the person is fully informed about their options, that each step that they're going to take is deeply thought out, and that it's internally motivated. In other words, it's something that is so important to them that they want so much that they're willing to make major life changes. In motivational interviewing, you engage the participant in a collaborative conversation to strengthen their motivation and their commitment to change. And framework for motivational interviewing is provided by the stages of change, which we'll go through in a minute, with acceptance and compassion at the heart of motivational interviewing. Conversation also includes moving from status quo talk, this is the way my life is now, to change talk, this is what I want my life to become. So people normally enter into a decision-making stage in what we call the pre-contemplative stage. This is where they haven't yet thought of what they're going to do to make changes in their life, but you want to start introducing to them the idea that there are choices available. That moves somebody towards the contemplative stage of life, where they begin to think about, if I were to change this, how would my life be better? And once they've done that, then they move into determination, where they decide on a goal and begin to build a plan, which they then put into action to achieve their goal. Now, relapse is a part of recovery for everyone. So people sometimes will be moving forward towards their goal and then relapse, but really they just come back into the process right where they were before. Relapse is not failure. Relapse is just the natural part of life. And then hopefully we all move on in our recovery to where we're in the maintenance phase of trying to keep our recovery in the balance that we choose. A key aspect of motivational interviewing is what we call change talk, and there's two parts to change
Patrick,
talk.
I'm sorry. This is Casey. Can you just speak a little bit louder, please? I'm having a hard time hearing you.
I'm sorry.
Thank you.
So an important part of motivational interviewing is what we call change talk. And change talk has two phases. The first part is preparatory, when people are getting prepared to create change. And so there they want to identify their desires, their abilities, their reasons to change, and their needs to change. And once they've done that, then they move into mobilization. And that involves commitment, activation, and actually taking steps to achieving a goal. Change talk includes using open-ended questions, affirmations, reflections, and summaries. So those are basically the effective listening skills that we talked about earlier. Siobhan?
Also, with the change talk conversations, the open-ended questions, the main purpose there is to be curious and ask about change talk, to elicit more input from the participant, from whoever you're speaking with. The affirmations are to acknowledge and positively comment on change talk. So to recognize change talk when it's happening and to affirm it so that it continues, to make it a positive thing, bring light to the fact that it's a positive thing. And reflections, reflective statements are basically there to create more change talk. So if you go back, look back to when you were doing some change talk, when your participant was doing change talk, then you're more likely to elicit additional change talk. It's kind of a cycle, change talk emits change talk. And the summaries help orient towards change. Patrick, did you have more on motivational interviewing?
No, I think, unfortunately, we're having some technical difficulties, and Siobhan is unable to see the screen. So we're moving into psychiatric rehabilitation now.
Okay. Psychiatric rehabilitation focuses on helping individuals to develop skills and access resources, the resources that they need to increase their capacity to be successful, to live satisfied in their working and learning environments and their social environments of their choosing. So the expansion of the peer roles in psych rehab has had at least 5 attributes, major contributions that the peer role has had in psychiatric rehabilitation. One was to deliberate expansion of a peer's role beyond that of a user or recipient to include helping and supporting behaviors and activities. So we're more than recipients of services, we're providers of services as well. An empowerment of the peer role by recognizing that peers can offer resources that traditional professionals either cannot offer or they choose not to offer. So there's the mutuality there, and there's the disclosure that we as peers can do that often traditional professionals are not able to or not permitted to do or simply not willing to do. So it takes down the boundary that often people will put up because now they can relate to someone, and that's the peerness that that we have in psychiatric rehabilitation. Expansion of what's meant by credentials to legitimize the understanding, knowledge, skills, attitudes, and motivations peers have gained through their encounters with service systems and their experience as mental health clients. So the peers are now being recognized for the value of their skills, the value of their experience, and the value of their ability to relate and connect to other peers. A view that some kinds of situations and roles, such as outreach, can best be fulfilled or led by providers who are themselves recipients of mental health services. That basically means that we've been there, so we know the system, we understand the system, and we're very equipped to help people navigate through the system. And a perspective that the provision of help not only assists the user or recipient, but can also create tangible benefits for the helper, whose identity can be strengthened by helping another person in need. So we are not only givers of support, but receivers of support. Again, it goes back to mutuality.
If you'd like to put up the video. Siobhan?
Yes, the video.
Hey, Mariah, how you doing?
Oh, I'm doing okay. I'm doing okay. I had a little car trouble this morning, but I was able to get out of it, and the car is running better now. So I guess I'm all right. I'm a little upset over the money that I spent, but what are you going to do about it? Cars cost money.
Indeed they do. But they're candy to have around, aren't they?
Oh, I couldn't live without mine.
Okay. You ready for us to get started today?
Yeah, I'm ready.
Okay. Well, today I have a worksheet I'd like us to look at.
Mm-hmm.
If you remember last week, we talked about friendship, We talked about, I believe you said integrity and honesty were at the top of your list for qualities you want in a friend.
Yes. Yes, that's the most important thing.
So we're going to look at that a little bit more closely this week. We're going to focus on the trust. So I've got a worksheet here for you.
Oh, okay.
Called Trust Me. And it's going to help us look a little bit more at that.
Okay. All right.
Is this okay, or was there something else you wanted to talk about today?
Wow.
Okay.
Well, my therapist tells me that I've got a lot of trust issues. I mean, I've been married 4 times, and each one of those people, they stole from me and did all these terrible things to me, and I feel as though every time I trust somebody, they turn around and stab me in the back. So I'm getting to where I don't want to trust anybody because I'm afraid of what's going to happen, that I'm going to get hurt again.
That's understandable. I've experienced that myself. So let me ask you, what is trust?
Trust is always being there when you're needed, and to do what you say and say what you mean, and just like what they say in the Marines, semper fidelis, always faithful.
Always faithful.
Always.
Okay, well that's actually our first question on the worksheet. So could you write that down for us?
All right, I'm going to say semper fidelis. Okay.
Okay, let's look at the next question. What do we have here?
How can you get someone to trust you? How can you get someone to trust you? Oh, well, I think that it's something that takes time to build up. I'm doing what I say that I'm going to do, and being there and being reliable. I've been very conscientious at work, and I've always gotten good reviews. So I've been given a lot of trust by my employers.
Okay. So can you think of somebody that you don't trust and why you don't trust this person?
Well, I don't trust any of my ex-husbands. The divorces were just awful. But I don't really see them anymore.
Okay.
But I guess the person I don't trust off the bat is this neighbor I have. She's always looking at me funny through her window whenever I'm coming and going, and she just creeps me out.
Well, has she ever said or done anything that makes you not trust her?
Like what?
Well, for example, I don't like people, or I don't trust people who gossip. People who talk about somebody else behind their back to me, because I figure they're just doing the same thing to me behind my back.
Oh yeah, that's what they say. Yeah. That's what happens with gossips.
So has she ever done anything like that, or has she maybe stolen from you?
Well, not exactly, but some time ago, this was way back in January. She needed to make a car payment, and she didn't have the money, and she came to me with this big long song and dance about how she needed the money and that she needed the car to be able to work. And I went and I loaned her this money, and I haven't seen a penny of it since. So she kind of has stolen from me.
Okay. So it sounds like this neighbor is not trustworthy with money.
Yes.
And you've never talked to her about it?
I think she's been avoiding me. She looks out the window at me, but she doesn't come out. I haven't really spoken to her. She's been avoiding me ever since I loaned her that money.
Okay. All right. Well, how about we look at the next question? There we go. Would you trust her with something smaller? Could you trust her with something smaller? Something of less value, maybe.
Other things?
Yeah, maybe some smaller things that don't have such high value. Like, would you tell her a secret, or would you, tell anybody that you don't trust? Would you tell them a secret?
Well, it really depends on what the secret was. If it was something that had been told to me in confidence, I wouldn't tell that. But But I guess if it was something really trivial, I might. That would be a way for me to see if they were, if I heard back about it, if they were gossiping about it or anything. That'd be a test for them.
That's right. That sounds, yeah, that's exactly right.
Mm-hmm.
Okay. Be careful with that. So maybe you can trust her with something small,
Mm-hmm.
see how she handles it, and then build on that trust gradually if she successfully handles the test.
Well, it'd be nice if she paid me back some of that money.
Well, we actually have a role play that might help you with that.
Really? A role play?
Yep. So we can act it out together, and you can kind of practice what you want to say, what you want to communicate, and the things that you need her to know. So that way you get your message across and you're more comfortable doing it. So we could try that for next week, if that works for you.
Oh, yeah, I guess so. Yeah, role plays work pretty well because I've done that with my therapist before, and it helped me out in some really delicate situations with my ex-in-laws.
Okay, so we'll schedule for next week
Mm-hmm.
to do that role play.
Okay.
Hey, Mariah, how you doing?
I'm doing okay. I'm doing okay.
How was your week?
It's been busy. It's been busy. I've had a lot to do, but I like staying busy.
And your car, is it doing all right?
My car had to go into the shop today, and it had this really weird problem, but I think it's been fixed. But I had to pay out kind of a lot of money for it, and I'm upset about it.
Yeah, I remember we talked about that last week.
Mm-hmm.
Okay, well, we also last week talked about the Trust Me worksheet.
Yes, I remember that. That was a little bit difficult.
Okay, so we can take it easy this week. That's okay. But we talked about doing the role play
Mm-hmm.
with your neighbor.
Yes, that's right.
Okay, so as promised, I brought the role play worksheet,
Mm-hmm.
so we can take a look at this.
Okay.
Can you read that first one for me?
Yes, making requests. A good friend of yours has borrowed money from you on several occasions in the past. You believe that the amount that they have borrowed has become too much. This person owes you $50, and it's becoming difficult for you to keep lending money to them. You decide to ask for a repayment of the amount owed to you. Well, that really is what's going on.
Mm-hmm. Sounds fitting, right?
Yes, it does.
Okay, so you know how role plays work.
Mm-hmm.
You're going to be you, and I'm going to play the part of your neighbor.
Okay.
So we're gonna act out this scene, and you're gonna try to get your money back from me.
Okay.
So for starters, I'll just give you a little feed into it. Just try to set the scene first, set the atmosphere,
Mm-hmm.
and then go into what you need to do.
Okay.
Okay?
All right.
All right. So start when you're ready.
All right. Okay. Well, I guess I'm gonna have to go and knock on her door.
Okay.
So,
Hello.
hello, Siobhan. Are you in?
Yeah. What do you want?
Well, I need to talk to you.
All right. Hang on. Come on in.
Okay. How are you doing?
I'm busy, but I'm okay. What do you want?
Well, you know, last January I loaned you that money for your car payment, and this is now the end of August, and you haven't paid back any of it, and I really need it because my car had to go into the shop today, and I'm afraid that I'm not going to be able to make my bills now because I'm on a very limited budget.
Well, I don't have it.
Well, when do you think that you will have it?
I don't know.
Well, when do you get paid next?
Next week?
Do you think that you could give me anything next week?
Take my word for it. We'll work it out.
We will?
Yeah.
Okay, because I really do need it. I really do need the money.
Maybe we can work out a payment plan.
Okay, well, that's what I was thinking. That would work. I'd be willing to do that. I know it's hard to come up with that much money at any given time.
Okay, so do you want to write it out, or do you trust me?
I think things are always better in writing.
I can understand that.
Yeah, they're always better in writing because then you got your boundaries all set up and everybody's on the same page.
Okay, tell you what, I appreciate you loaning me the money. So we'll work out a payment plan, and I'll work on paying you back.
Okay, well that sounds like a good plan.
Okay.
Okay.
Well, thanks for stopping by.
All right. All right. Bye-bye.
Bye-bye.
So these role plays and these skill building exercises are a fundamental part of the program. And on our website, and I believe the website address was posted earlier, but you can just go to www.mentalhealthamerica.net and just look on social self-directed care. We have many of the skill building exercises as was shown in this video, and then we also have suggested role playing activities for people. We also have all of the forms that are needed to do the self-directed part of the program, and we have a full training manual available for free that you can download. If you need a printed copy, you can contact us by email and we will send you a printed copy of it. So our coaches are available for individual training either by phone or video calls. We like to do it by Skype when we can. We're also available for in-person training, though there's a fee for that for us to come to your location to do training. Like I said, this program took several years to develop and then 2 years that it was piloted, and the outcomes from the program were remarkable. We saw quality of life indicators using personal outcome measures increased by about 65%, so that people rated their quality of life 65% higher. We had people making statements that in the very beginning when we first interviewed them, they had no friends at all, and by the end of the program they had one friend or as many friends as they wanted. We had people saying that this program completely changed their lives. And then some of the things that also interested us was, like I said, we kept track of rehospitalization rates for people. And for the first cadre of women that came through the program, that particular group had had 15 hospitalizations in the prior 2 years. In the 2 years they were in the program, there was one hospitalization for the entire group. We also saw a drop in the visits to regular health care visits, to ER departments, to people getting sick and having better physical health. You know, your social life is part of your overall well-being, and when you take care of it, it helps to take care of other things. Personal training that we do identifies the key parts of psychiatric rehabilitation, and we use a course that's available online, and we recommend it, from Boston University on psych rehab. We also use the handbook called Becoming a Professional Life Coach, Lessons from the Institute of Life Coach Training by Patrick William and Diane Menendez. And we recommend that you get that. And then we have developed an examination that is available online also that you can take after you've gone through this book to see that you've captured the essential ingredients necessary to do this group. The third part that we encourage people to do is motivational interviewing. And if you use this website available here, or there's several other websites that have motivational interviewing, and we have a motivational interviewing resource on our website, so you can get that type of training from a number of different places.
Patrick, if I can add something.
Yes.
I wanted to add that the exam that we've created focuses on how you would apply those life coaching skills to peer support. Because life coaching is not the same as peer support. There are some differences, and some of those skills used in life coaching are not necessarily appropriate for peer support. So the exam that we've created helps to clear the blur of the lines there so that the skills needed for doing this program, for doing peer support, are clear between life coaching and peer support.
Thank you. Do you want to sum it up for us?
Sure. So this program has been just life-changing for so many individuals who've gone through it, and for the coaches. And that's the power of peer support, is that, again, it's not just providing services, but we receive assistance from the whole project as well as coaches. This program is designed to help individuals with serious mental illness to build networks of friends, to create intimate relationships and a strong social support system. It helps them to be active members of their community, to feel less isolated, and of course that helps to increase self-esteem and self-worth, which improves overall social functioning. The increase of physical health has shown a decrease in hospitalizations and, of course, avoiding premature death. The program is highly relevant to any whole health approach to behavioral health because, as we said, your social life is a part of your whole life. It's a part of your whole health. So it included things like savings and reduction of emergency room visits, as Patrick has already stated, increased overall health and lower hospitalization rates. This program would also be ideal for operation by a peer-run organization. Mental Health America is not a peer-run organization, but this program was run by peers. It was managed by a peer. It was instituted by peers and overseen by peers. So it definitely would be great for a peer-run organization. Having focused on one of the most marginalized populations and receiving such remarkable results, it would be a reasonable expectation that greater outcomes would be achieved for individuals with less complicated mental health challenges. So we worked with individuals with schizophrenia or schizoaffective disorder because they were the most marginalized, because they had the most challenges in creating a social environment for themselves. And so to have individuals with less complicated mental health challenges, then it makes sense that your results would be even greater.
So just to kind of wrap things up, this is a very simple program. The main parts of it are the relationship between the individual and their coach, the learning the ability to identify within yourself what your true goals are in life. What do you want out of your life? What are you looking for? You know, for some people, to have just one friend is their goal. For others, they might want a circle of friends. Some might want to have a very full social life. Some might like to just get together with one person once a week to have a cup of coffee. So it's a very simple program. The skills that the coaches need are key to it, but the individuals are set up in a situation where once they've identified their goals, they then create a plan of how they're going to achieve the goals. And then each individual was given a budget. And because everyone was on SSI, which, if you try to live on $730 a month, you know how little is left over for social activities. So each person was given a budget of $60 a month to only be used for social activities. And each month they had to budget how they were going to spend that money and then keep track of how the money was actually spent. And then that would go back to the coaches. And so you wanted the expenditures to match the budget, which matches the plan, which relates to the recovery goals. So self-direction, again, is a very simple concept. It's where you take ownership of your own life and begin to move forward. But we can't always do that by ourselves just from the beginning. You might need a little hand, and that's where the life coaches come in. So this is the second in a series of 3 webinars. We're going to be having the third one next month, and the announcement will go out by the end of this week about that. and we hope that you guys will join us. I'm sorry we had these technical difficulties today. It really did kind of throw us off kilter. And we probably should have told you that you needed to turn up the sound on your computer when you watch the video, but I assume most people figured that out since everybody stayed on the call. But anyway, we thank you very much. And Casey, would you like to finish up for us?
Yeah, well, did we want to answer some questions first?
Sure.
Okay, so we have a couple questions here about life coaching. Actually, the most recent one from Mary Ann. Peer support and life coach looks very similar. Is it safe to say that life coaching focuses on socialization more than anything else?
Siobhan?
Yes. What would you say is the distinction between life coaching and peer support specialist, and how does that play into this program?
Well, one of the major distinctions is mutuality. In life coaching, there is more of a sense of power differentiation that does not exist in peer support. So in life coaching, there's more of the coach knows, what direction to go and helps the participant find it. But in peer support, that the coach realizes that the participant already knows what it is that they want to do and what their goals are and what direction they need to take. And so we as peers help them to find it themselves. That's the main differentiation between life coaching and peer support.
Okay. So a couple of questions about receiving training. So these 3 webinars, this is the second of 3, are going to be on Mental Health America's website. I shared the link earlier, and I'll share it again in just a second. And you can review all of the materials and listen to the webinars and share those. And then it's pretty, we think it's pretty straightforward to implement. And if you have any questions, you can, of course, contact Patrick or Siobhan about answering any questions you have about actually implementing this. Another question. How many participants can a life coach or a peer support specialist work with on a given day?
But for the purposes of the pilot, we kept it at a very low number. We had 10 people to each coach. But as the program has matured and as we figured out a little bit better how to run it, we think that it's possible for a coach to work with 15 to no more than 20 people in a given time period.
Okay. What are your thoughts about providing this type of support in or as a small group setting versus an individual basis?
I'm sorry, I couldn't hear that.
What are your thoughts about providing this type of support in or as a small group setting?
Well, we do this on an individual basis because one of the things we determined very early on was, almost every community mental health center has some sort of social skills building program, and generally what it entails is bringing together consumers or peers to meet each other and engage in social activities. We wanted to make sure that we were connecting people to the world outside of mental health. And so we didn't do it as group activities, though we did have a couple of get-togethers that everybody enjoyed, that everybody was interested to hear about the other people's experience. But the real purpose of the program was to connect people to the greater world around them and to help them to learn the skills to go out in the community, to find people who have shared interests that they have, to begin conversations, to begin to build friendships, and to begin to build support.
There were instances where some of the ladies had their own, had goals that were similar to each other and activities that they wanted to do. For instance, we had several participants get together and go to the circus together. So it was an interest that they shared in common, which they discovered at one of our get-togethers. So it was, as Patrick said, we did have occasional get-togethers for all of the participants to be in one place and share their experience. And from that, while they use their skills that they had learned while they were in the program to communicate with other participants and to share with them, and to determine that they had this common interest of going to the circus.
Great. How does a potential employer ask about someone's status as a peer without overstepping the boundaries about someone's disability?
That's a really good question, and the answer is in the job description. When you're preparing to hire somebody in a peer position, you want that to be very, very clear in the job description that having lived experience with a psychiatric diagnosis is a requirement of the job. This allows you to ask the question without violating somebody's rights to confidentiality. The person knows that they're applying for a peer job, and so the question is allowable.
Okay. Allison, I don't know how I feel about the caseworker encouraging the client to test her neighbor with a secret, and I think this is in reference to the role play video. This encourages the client to manipulate others and might encourage her paranoia in trusting others. What is your response to that?
I'm sorry, Casey, could you read that one more time?
Yes. I don't know how I feel about the caseworker encouraging the client to test her neighbor with a secret. This encourages the client to manipulate others and might encourage her paranoia in trusting others.
Well, I appreciate that perspective. It's very individualized. It's once you develop a relationship between the peer coach and the participants to know what their boundaries are, to know what their skills or limitations are, and you build upon what their strengths are. So if that's something that is a strength that the participant, has, that the coach has noticed, and feels that the participant's ready for it, then the suggestion is made, but ultimately the decision, of course, relies in the peer to make that decision for themselves.
Okay. What are your thoughts on providing this support to transitional aged youth and teens?
I think it's a great idea. The difficulty there is finding the peer specialists that you can hire that are of the proper age group, because you want them to be able to relate directly to their coach. It doesn't work so well when you have a 20-year age difference between the person receiving the services and the person providing the support. But I think it can work extremely well with transitional age youth. That this is a time of life when many of us go through feelings of social disconnection, and so I think it would be wonderful. I know Youth Move has a transitional age peer specialist program that they're developing. That would be a good group to work with to get the kind of training that you want, to have somebody, and then do these additional trainings that go along with the program.
All right. Is there a training for life coaching that is standard?
Life coaching is a wide open field. There's many different thoughts on what life coaching is, and there's many different styles. We went through a number of different organizations that provide life coach training before I selected the one that we did, because it seemed to offer the best set of skills to match up with this program. But they're not all alike. Some life coaches rely more on their ability to work with people in the job place. Some rely on people to develop social skills. The one thing that they all pretty much have in common is providing validation and encouraging people to move forward and trying to create positive change.
Okay, and I think this is going to be our last question. What kind of supervision did you find effective with life coaches?
with the life, now we called our coaches life coaches, so it gets a little confusing because there are professional life coaches that are kind of an industry on their own. We happen to call our coaches life coaches because it seemed appropriate. Use basically the same supervision model you use with any type of peer support. You want to make sure that the person providing the supervision has a real fine understanding of recovery, has an understanding of what peer support can do, how it's different from traditional supports and services, and then what are the boundaries that are appropriate to peer support, because they are very different than they are for somebody else. I mean, you know, if you're working in a community mental health center as a case manager, for instance, you're not going to have a personal relationship with the person that you're providing services. When you're a life coach in this program, you actually become a friend to the person, and those friendships continue on beyond the program. As I said, the life coach tends to start withdrawing services, but they're not withdrawing in a friendship. So there's a substantial difference.
And when it comes to supervision, I think it is definitely would be a key asset, though maybe not necessary. Very helpful to have a peer as the direct supervisor for the life coaches, and have them definitely understand the importance of peer support for the peer supporters. To understand that the peer coaches need to be able to maintain their own recovery as well as helping individuals, helping the people that they're working with in the program.
All right. Well, thank you, Patrick and Siobhan. I just wanted to thank Janssen again for sponsoring not only our pilot program, but also these training webinars and the development of all of our training materials. You'll see a survey after at the conclusion of this webinar, so please fill that out if you can. We really appreciate your feedback. And if you have any questions, feel free to reach out to Patrick and Siobhan. Patrick's email was listed before, I believe. It's phendry@mentalhealthamerica.net. Siobhan's is scarpenter@mentalhealthamerica.net. And you'll be getting a follow-up email with a link to the slides and the recording, and that'll also include their email. So if you have any questions, please reach out to us. We'd love to help you implement this in your communities. Anything else to add?
If you would like a certificate of participation, please do feel free to email me. And I would like to also note that CEUs are not being offered for this webinar.
All right, thank you.
And to the last question I see up there, yes, there is a third part to this program. It'll be in November, and we will be posting that within the week. So thank you, everyone, for attending, and hopefully you find the program of interest.
Thank you.
All right, thank you, everybody.